Hello, everyone. Thank you for joining us. I'm Bertha, Director of Population Health at Utica Park Clinic. Just wanted to introduce a couple of our social workers to you, Sarah McKinney and Sam Thomas. They're going to be sharing with you some information about community resources. Sarah?
Hi there, everyone. I am a social worker at Utica Park Clinic, and I'd like to talk to you about community resources and what you can develop for your toolbox. So, what are community resources? Community resources are assets in a community that help meet certain needs for those around them, such as food banks, mental health centers, churches, state programs, public transportation, employment agencies, elder care assistance, and medication assistance, among other things. So why are community resources important? Well, patients frequently have challenges due to a medical condition or challenges that are affecting a medical condition. For example, patients frequently have depression, anxiety, poverty, they might be dealing with divorce, unemployment, and the list goes on. So by referring patients to community resources, this can help alleviate the negative impact of these psychosocial issues. By taking advantage of organizations in your community, you can help patients and their families grow and ultimately improve outcomes. So who identifies them? So really everyone helps with identifying community resources. Sometimes our patients tell us of something in the community. Our providers might know of something. Care coordination nurses, social workers, basically all clinic staff. Also, partner agencies such as My Health are a good resource, and payer sources. So how are they located? So community resources are located through our a big way is through individual and collaborative relationships and those agencies we partner with in the communities, as well as our own research, trainings, personal experience, patients. By networking, we can learn more, professional organizations such as CMSA, and hospital-based case managers. So when are they needed? So community resources are needed when a patient has, for example, multiple hospitalizations, ER visits, lengthy differential and diagnoses list, or perhaps they have poorly regulated long-term pain management, functional illnesses, unexplainable symptoms, mental health issues, and a big one is financial burden. I'm going to hand it over to my colleague Samuel Thomas now for patient assessments.
Assessment of patient needs. So this is systematically assessing patients' psychological needs using an evidence-based tool such as a PHQ-2 or 9. Using this, you can create a patient-specific, tailored inventory of resources and supports to meet individual psychosocial needs. This includes family members, churches, social organizations, even a bridge group can meet many of these needs. Using motivational interviewing, you can allow the patients to drive this change process and really offer clinicians and all of those of us who are located in the clinic a real window into the resources that they already have. So assessment of clinic needs is identifying your high-risk, high-ED users, okay? Starting by identifying a high-risk subpopulation, such as diabetes, CHF, dementia, or COPD, you can start to develop a top 5 population, social services intervention, and the correlating distributable resources. So this is using a data-driven identification process of your highest risk users and starting to develop a way to assist them with the barriers to their health care. A lot of this is identifying whether it's transportation, prescription assistance, food assistance, hospice, skilled nursing facility placement, or just general financial assistance. So the use of psychoeducational groups and patient family advisory councils, feedback is a great way to foster a sense of patient ownership in the care process. So by identifying these subpopulations, let's say diabetes, for example, you can really take care of multiple needs at once by offering that psychosocial diabetic education, but also assessing what needs kind of come along with that, like high-cost prescriptions. Identification of your clinic's social service needs will allow care coordination to shift from treatment to prevention when addressing these high-risk needs. Use your clinic's data trends to regularly assess and revise social service delivery and the internal workflow. So that's just going over and making sure that those top 5 lists are still the same. Is it still food insecurity, housing, transportation, and utility assistance, or are you getting more referrals for, say, prescription assistance this month? Resources. So focus on distributable resources for those common needs that you have.
Sam, one of the things I want to encourage everyone to do is take a look at our website at uticaparkclinic.com under social services, and you're welcome to use, share, and replicate any of the resources we have on our website. Additionally, want to make you aware of the case management professional organizations that are available. These are listed for Oklahoma, the Case Management Association of Eastern Oklahoma, as well as CMSA of Oklahoma. Both of these organizations have regular all-day symposiums and professional meetings that not only provide education, but more importantly, introduce you to some of the social service organizations, community resource organizations that are in your area that you may be able to get additional information and make, more importantly, that relationship and network connection.
Next thing we have is Life Senior Services. This is a really invaluable service that most care managers as well as my social worker colleagues and I use. So we have different branches, but they're a resource on different kinds of assisted living, hospice care, different kinds of community needs, as well as independent living, dementia, Alzheimer's. They're really a one-stop shop for senior services in the Tulsa area.
Sarah, one of the things I really like about them as well is they give you a checklist. What do I need to look for when placing my parent into an assisted living? And they give you a checklist to help guide someone through that process.
Exactly. They have a Life Vintage magazine, which you can pick up either at their clinic, but sometimes they're even at Quick Trips and local YWCAs, and they really are informative about what to look for if you are checking out a nursing home, what signs to look for if it's time for a nursing home, and they're really good primer on a lot of those aging issues.
211 Oklahoma and also for Arkansas. So 211 is an excellent resource. You can just dial it on your phone, and they really do run the spectrum of human need, and that's including but not limited to rental assistance, food pantries, affordable housing, health resources, child care, after-school programs, caregiver support, financial programs, literacy, and job programming.
This is a new one for us. We learned about this recently called Aunt Bertha. It is supposed to be a nationwide program, and you can see here from their website a number of different resources that we've just discussed, adding a legal resource in there as well. So check out Aunt Bertha and let us know what you think about it.
So here is the Advantage Waiver Comprehensive Assessment Tool, the referral that we use. We've included a link to this form in our resources section. I would suggest that every clinic out there print this off and have this on hand to fill out with patients who they believe may qualify for Advantage.
Next one is the Alzheimer's Association. So this is a helpline that is available 24/7, and it's available wherever you live in the United States. They can help you, think about legal, financial, living arrangement decisions, medications, treatment options, and just general information and help you might need about your loved one that might have Alzheimer's or dementia.
So we've included this in our resources page, but retirementjobs.com, in addition to the next slide we have is Senior Job Bank. These are both listings of employers who specifically are looking for 50 and up. This is just outstanding for so many of those patients who are looking for a little additional extra income, but really aren't sure where to start on the job market. So we'll include both of these in our resources listing at the end, and I encourage everyone out there to check them out. Advanced care planning. So advanced care planning is making decisions about the care you would want to receive if you became unable to speak for yourself. These are your decisions to make regardless of what you choose for your care, and the decisions are based on your personal values, preferences, and discussions with your loved ones. The conversation is not an easy one to have, but the following tools can help get you started. All of these tools we have listed in our resources page, but also we have these listed at uticaparkclinic.com, and I would really encourage you guys to go and check them out. And additionally, we have a couple of videos specifically targeting advanced care planning, so please, everybody, check them out at uticaparkclinic.com.
Finally, our goal is to prompt you to have some questions so you can get some answers that you need when you come to our care management boot camp. We're looking forward to seeing you guys all there. Thank you for joining us.